Ringing in the ears, or as it's also called, tinnitus, everyone experiences it differently. Some describe it as the whine of a mosquito, some as an ultrasound, and for others, it's a humming sound like a jet turbine. But one thing unites everyone. This noise is distracting and sometimes makes it impossible to live normally, especially at night or during moments of complete silence. If you stumbled upon this video by accident and you don't have this ringing, please remember this important thought. Protect your hearing. It is very, very important. I want to make a disclaimer right away. Although these methods are very effective and help hundreds of thousands of people, we need to be realists and understand that at this moment, scientists cannot explain the nature of this phenomenon with precision or eliminate it with a 100% guarantee. We can only try to find our own approach to cope with the noise, or at least make it quiet enough so that it doesn't interfere with a comfortable life. That is exactly what we are going to do today. Recently, I ran a poll in our community which showed that 60% of our channel's viewers have ringing in their ears. 197 people over the age of 50 took part in the survey. Therefore, if you have this noise, do not consider yourself alone in your problem. There are many such people, and today I will try to help you. Today, we will break down 6 specific reasons for tinnitus, and for each one, I will give a solution. And in the second part of the video, I will share secret sound masking techniques if the exercises don't help remove it completely. Let's go. Reason 1 is a violation of microcirculation. With age or due to thick blood, the hair cells of the inner ear receive less nutrition and begin to send phantom signals to the brain. The solution is the heavenly drum technique, but it must be done correctly. Tightly cover your ears with your palms so that your fingers are pointing back towards the back of your head. Now, find the protruding occipital bumps with your middle fingers. These are the bones at the very bottom of the skull. This is the key moment. Place your index finger on top of your middle finger, and then forcefully slide it down so that it strikes the bone. Inside your head, you will hear a characteristic booming sound, similar to beating a drum. Don't rush, do this rhythmically. 1, 2, 1, 2. We need to do 20 or 30 of these taps in one set. Feel the vibration spreading across the back of your head. Take a small pause for half a minute, let the blood rush to the tissues, and repeat 2 more times. This powerfully stimulates the auditory nerve and improves local blood flow. A small request. Please hit the like button on this video so that more people with ringing in their ears who need help can find it. Thank you. And now, let's move on to the second reason. Reason 2 is trigger points in the neck. Often the cause of the noise is not the ear itself, but a spasm in the sternocleidomastoid muscle. Painful knots form in it, which reflect sound directly into the ear canal. For the solution, we need deep tissue work. Turn your head to the side, and you will see a large oblique muscle that runs from the ear to the collarbone. Grasp it in a fold with your fingers, as if you are making a pinch. Start slowly feeling along its entire length, from top to bottom. You are looking for a place where the muscle feels hard, like a taut rope, and causes sharp pain when pressed. As soon as you find such a point, stop. Don't just stroke the skin, but deeply clamp this knot with your fingers. The pressure should be palpable, about a 4 or 5 out of 10 on the pain scale. Hold this pressure for 30 to 40 seconds or make small, squeezing circular motions. You will notice that after half a minute, the pain will begin to dull and the muscle under your fingers will become soft, like plasticine. Often, at this very moment, the ringing in the ears becomes quieter or disappears altogether. Work through the muscle on both sides this way. Reason 3 is the temporomandibular joint, TMJ. Tension in the chewing muscles presses directly on the auditory canal. First, find the small indentation right in front of the tragus of the ear. Gently massage this zone. Now go down a couple of centimeters lower to the angle of the jaw, where the powerful chewing muscles are located. To feel them, tightly clench your teeth. You will feel hard lumps under your fingers. Relax your jaw and start deeply kneading these muscles with circular movements. For most people, they are stone hard due to the habit of clenching teeth during stress. During the massage, try to smoothly, very slowly open and close your mouth. If you hear a distinct click or crunch in the jaw while doing this, this is a signal that you definitely need to see a dentist or a gnathologist. Sometimes a special night guard to relax the jaw removes years of ringing in the ears in just a week. Reason 4 is limb stagnation and tissue stiffness. The ear should be elastic and mobile. Let's move on to special gymnastics for the auricles, ears. Do everything along with me, step by step. First, grab your earlobes with your fingers and pull them strictly downward with moderate effort. Do this 10 times. 1, 2, 3. Feel the tissues stretching. 7, 8, 9, and 10. Now regrip your fingers on the upper edge of the ear and pull it upward, towards the top of the head. We also perform 10 repetitions. Don't rush. Make the movement smooth and deep. We are kneading the cartilage so that it becomes soft and pliable. Now grab the middle of the ear shell and pull the ears out to the sides, away from the head. Again, we do this 10 times. You should feel warmth rushing to your ears. This means that we have successfully triggered lymph drainage and blood flow in this zone. To finish, do a few soft circular rotations with the entire ear shell so that the skin around the ear becomes truly warm. And the final touch, the vacuum exercise. Tightly press your palms against your ear openings so that no air remains inside. And then sharply, but carefully, tear your palms away from your head. You will hear a light pop. Repeat this movement 5 times. This exercise creates a gentle pressure difference that trains the mobility of the eardrum and relieves stagnation deep inside. Reason 5 is hidden allergies. Few people know, but the nose and ear are connected by the eustachian tube. With allergies, the mucous membrane swells, this tube gets blocked, the pressure inside changes, and a hum arises, like in an empty seashell. If you notice the seasonality of the noise, or if it intensifies at home, this could be swelling. Try taking allergy tests. Frequent culprits: house dust, mold in the bathroom, animal dander, or even the down in your old pillow. Sometimes replacing a pillow with a hypoallergenic one solves the tinnitus issue. Reason 6, the most serious one, is sensory neural hearing loss. Often, noise is the first scream of a dying auditory nerve. You may not yet notice that you have started hearing worse, but the brain is already trying to compensate for the lack of sounds with an internal squeal. It is especially dangerous if the noise is heard only in one ear or if it differs sharply in tonality on the left and right. In this case, do not self-medicate. Urgently go to an audiologist and get an audiogram. It is extremely difficult to return lost hearing, but timely prescribed therapy will help save those cells that are still alive and stop the process. If you have undergone examinations but the noise still remains, do not despair. The brain can be tricked. Most often, tinnitus torments us at night when the room becomes absolutely quiet. In this silence, our internal filter cranks up the volume of the squeal to the maximum. Our task is to give the brain a safe external background noise. But first, if you are not subscribed yet, please subscribe to the channel. We regularly release practical tips and exercises for older adults that could be useful to you. Thank you. So, right now I will turn on 4 of the most popular masking sounds. Listen to them carefully and try to determine which of them best dissolves your noise. Which sound from our test suited you the most? Write about it in the comments. Find the sound that is pleasant to you, download it to your phone, and turn it on at minimum volume before going to bed. You can set a sleep timer for 30 minutes. When the brain hears an external sound source, it calms down, stops looking for danger in the silence, and falls asleep quickly. And one more important psychological moment: try not to listen for the noise. The more often you check, well, is it ringing or not? The more you train your brain to pay attention to it. Treat tinnitus like the noise of an old refrigerator. It's there, but it's not interesting to you. Over time, the brain will simply stop bringing this signal into your consciousness. How not to lose your hearing. And now, how to prevent the situation from getting worse. We live in a very noisy world, and our ears are simply not designed for such loads. Firstly, take care of yourself in everyday life. You have no idea how aggressive ordinary tools are. Working with a drill, a rotary hammer, or mowing the lawn for a long time without protective earmuffs is a colossal blow to the auditory nerve. If you started a renovation or are going to mow the grass, always put on construction earmuffs. The same applies to very loud music. If you listen to it in earbuds at maximum volume, you are literally burning out your auditory cells. Secondly, pay attention to transportation. The roar in a subway car or the noise from a jackhammer on the street can cause microtrauma that accumulates over time. If your work or commute involves constant loud noise, use earplugs. And thirdly, be careful with medications. There is a whole list of so-called ototoxic drugs. These are certain antibiotics, strong painkillers, and diuretics. They can poison the auditory nerve. Always warn the doctor. I have a tendency toward ringing in the ears. Please select drugs that do not affect hearing. This is your personal safety. If you have your own way to make the ringing in the ears quieter or mask it, be sure to share it in the comments. Let's help each other. I wish you health and blessed silence.